The member from London West.
Thank you, Speaker. My question is to the Deputy Premier. On Saturday, we learned that the London and District Distress Centre will close by the end of the year, with its crisis response line transferred to the provincial agency ConnexOntario. That same day, NDP leader Andrea Horwath joined me and the member from London Fanshawe in London as we listened to patients and healthcare providers share horror stories about the failure of our healthcare system and the crisis in mental health. Speaker, telephone crisis support provides a key entry point into a mental health system that is already stretched to the limit. Too many Londoners in crisis have been turned away from ER or forced to wait days to access emergency mental health services. The new 24/7 Mental Health Crisis Centre is already at capacity. What will the Deputy Premier do to ensure that the community mental health services Londoners need are in place after they call the crisis line?
Thank you.
Well, thank you very much, Speaker, and thank you to the member for London West for this very important question. And I know that she genuinely does care about having the right supports there for people who are struggling with mental health issues. I can assure you that this is a high priority for our government. We have invested substantially in mental health services, Speaker, including, as she mentioned, the new 24/7 Crisis Centre that is a made-in-London innovation that I do hope will spread to communities across the province. It was the result of everyone in the community coming together and designing a solution that fit the needs of London, Speaker. As she mentioned, it's at capacity. That tells us that we were on the right track when we funded it, but there's more to do, obviously, Speaker. And having a place where people can call when they are in distress is an important part of the continuum of services.
Thank you. Supplementary, the member from London Fanshawe.
Speaker, London's new 24/7 Mental Health Crisis Centre was full almost from the day it opened. About 70% of those walking in the door are first-time users of mental health supports. 60% of people are under the age of 35. Clearly, the demands for mental health services in London are increasing and will continue to grow. What concrete action will the acting Premier take to expand access to community-based mental health services in London?
Thank you.
Thank you, Speaker, and I do thank the other member from London for this question. And again, I think we're all on the same page when we say we want the best possible services for people struggling. And that's why, Speaker, we've invested substantially in mental health. In
Order,
fact,
please.
we have almost doubled the funding for mental health and addiction services since we were elected. We have developed comprehensive strategy that we are implementing. There is no question that people facing mental health challenges need and deserve to get the support they need in a timely way, and we're making important investments to achieve that goal.
Thank you.